Welcome to Accelerate My Practice. So glad you could join us here today. We're still down in South Padre. Not a week later, we're going to film a couple shows while we're here. But we're down here, and I wanted to interview Dr. Gary Schwarz, because this might be about the most interesting man, and you kind of look like the guy from the commercial, might be about one of the most interesting men I've ever met. Everything from Jeff Foxworthy, growing great big huge racks on deer, growing great big bass, wonderful dentistry, oral surgeon, and I wanted to interview him because, one, it's just kind of fun to meet new people and to bring them on and expose them here. And I think that he probably has some things that, from a clinical perspective, you might all find useful and helpful. So I just kind of want to interview him and get to know what he's all about and share a little bit of his story with our whole crew out there and see what everyone has to say. So I want to thank you very much for joining me.
Well, you're welcome. It's been great to have you here. You've brought an energy to this Dentist Who Care conference of ours that unlike anything I think I've ever seen. I've heard the crowds in here in your room all day long, and I'm going to be in here myself tomorrow morning and listen to you guys.
Well, I'll have to raise the game then, because you've been around, you've done lots of stuff. Whether it's Jeff Foxworthy doing a TV show with him, you were talking earlier about something with Texas A&M and some competition where you had to lose a lot of weight and start trying to take on a football player who's an all-star football player. Yeah. What don't you do?
Well, I've had an interesting life. There's a lot of things I don't do. I don't golf. I don't play tennis. I don't play cards. I don't gamble. But I love my practice and I love the outdoors. And so those two things I focus on. And I love the Lord. And the spiritual side of my life has been a strong foundation. And my wife, on her knees praying for me, has gotten me through so many things. And the good Lord blessing me. So.
Behind every great man is an even better woman.
I'm telling you, that's
and
so
the guy
true
wouldn't
of me.
be there without her.
I'm telling you, that's so true of me, because I've been blessed in spite of myself, I think.
Me as well. Had you been here yesterday, you would have heard a whole lot of marital challenges I've been through, because I share a lot of my story. One, so people don't repeat it, and two, so they can learn from it. It's fascinating to see. So I'm right there with you. Without my wife behind me, I'd be a hot mess, to say the least.
Know that, so that's great.
Yeah, it's amazing. So, we were chatting a little bit about some of your implant work, and I want to chat a little bit about that because it sounds like you're one of the biggest or fastest growing, or you're someone in the implant world to be reckoned with. So it brings a level of expertise that I don't always get exposed to. Mm-hmm. So talk to me about some of the challenges you see for our audience about what they could learn regarding implants, mm-hmm. some of the common mistakes you see. Where are some areas that some advice could help some of these people out?
Well, what's helped me grow my implant practice so much is I look at it and say, what's been the key for me? It starts with the ability to impact that patient when they're in your office, obviously. In my whole life, I'd heard about treatment coordinators and implant coordinators and whatnot, and I just never found that person who could be that. But this young lady kind of dropped into my life, into my lap. I interviewed her. I wasn't even going to hire her. I didn't have that impressive interview with her, and I told her I'll call you back after I've interviewed a few more other folks. And she looked me in the eye and she said, Dr. Schwarz, you're going to make a mistake if you don't hire me. I said, really? And I said, tell me why. And she said, I'm smart, I'm loyal, I'm good, and she'd never assisted. I was interviewing for a surgical assistant, but I can learn to do that, and I promise you I'll do a good job for you. I said, okay, you're hired. She said, wait, there's one problem. You're not offering enough money for that position. And yeah. And so that's how it began with her. She was a terrible surgical assistant at the beginning because her hands shook like crazy. I thought, a rattlesnake tail is assisting me. That's how it started with it.
Gotta love the Texas metaphors.
But she got better and she got good, and then I saw her intellect, and then my Nobel BioCare implant rep broached the subject with me of starting Seattle Study Club. And I was bankrupt at the time. My wife told me I couldn't do more. My manager, my office manager told me I couldn't do more. No one thought I should do it. But I was at the point in my life in my mid-50s where I had seen my practice begin to level out. And one thing I've noticed is that as guys get older and their practices mature, that will happen. Once they level out, they're going to start going down.
Yes.
And the best solution is to invest in your practice.
Yes.
And so I said to myself, I've got to start giving back to this practice that has been so good to me. I'd had a great practice my whole life, and the implant practice, it just leveled out too, and at 300 and some odd implants a year, and I just couldn't get it. it'd go up to 350 and then down to 325, then up to 340 and then 330 and then 350, and it was just doing that. And I was frustrated that I couldn't get it to grow. And so I did the Seattle Study Club, but I had to find a coordinator to train to help me run it. And it ended up being this gal. And I sent her for training, and the first time I put her in front of an audience, she just froze. But she was awesome one-on-one. And then the next thing I know, various events happened in my practice that made sense to me to have her start communicating with patients before I got in the room. One of which was a requirement to go paperless and to have an electronic chart, which required the inputting of massive amounts of information in the chart about their medical history and all this other stuff. And I found myself with my back to the patient more than my face to the patient because of all that stuff I was having to do. So I said, all right, I want you to go into the room with the patient first, enter all that information, communicate with the patient, and one thing led to another, and she became this incredibly effective communicator and my treatment coordinator. And as she every year we would do the Seattle Study Club speakers, she was learning. And I'm telling you, she can treatment plan most cases better than 99% of the dentists I work with. And so she's able to prepare this patient so well and educate them on all the various things before I ever walk in the room. So that's number one, having that really gifted, caring person in your practice. And it can take you 20 years to find her. I've been practicing since '83, and I've had her in this position for the last 5 years. So that's number one. Number two, I would tell you simplifying the process for me to where I can move quickly and not drag things out with that patient. I've been there with that philosophy that you've got to have a surgical guide for every case. If your surgeon's not using a surgical guide, find another surgeon. I'm going to just tell you that's baloney. The best thing that ever happened to me was hearing a dentist who did implants talk about why surgical guides are not the solution and the problems with them. And I'm sitting there going, that's why surgical guides are giving me so much of a headache. Most of my bad implant positionings were because of surgical guides. And so I began using calipers and paralleling pins and two-size charts and crown and bridge visual principles. As a dentist cuts a prep, he's using visual principles of crown and bridge to know exactly what to do. And taking those skills I learned in dental school and then applying those and not using a surgical guide, that frees up a step. I don't require the dentist to have to do that. So the banker walks in, he snapped off a crown that day, and he's in a panic, What is he going to do? Well, how much does it help? Do you want me to stop?
No, keep going, love it.
How much does it help to be able to strike while the iron's hot, and take care of him in that moment?
Absolutely.
Not requiring a surgical guide, that's number one.
Yep.
Number two, minimally invasive surgical techniques.
Yes.
I do not remember the last time I laid a flap to take out an erupted tooth.
So you do still punch?
I use proximator with a mallet.
Awesome.
And if that doesn't do it, and I've got to section the root, then I section the root without a flap. No flap, no bone removal, no labial plate removal, flapless surgery. Huge, huge boon to my practice because the other surgeons are still practicing the way they were taught, which is you can't do it well if you can't see it well. That's what they still teach in school, so many of them.
Yeah.
So lay a bigger flap, cut away more bone is the way to get these impacted teeth and hard to remove teeth out. And with me, if they're erupted, no incision, no bone removal. If they're impacted, minimal incision, minimal flap reflection, minimal bone removal. And so your swelling goes down, your pain goes down, your bleeding goes down.
Your healing time gets better.
And guess what happened? That patient goes back to their dentist, and they haven't had all those issues when they came here versus other places that the dentist hears patients have those problems with. And so that's huge, being able to move quickly.
So you're telling me even after 30 years of clinical practice, continuing education is the key, rather than doing it the same old way?
Yes.
I had a doctor in Nebraska once who was looking at hiring me. And he looked at me, and he's 60 years old, and he looks at me and goes, I don't know if I want to hire you because, I've been doing this 30 years. I know what I'm doing, and you're just this young puppy. What do you know? And I looked at him, and I was like, I don't know. I went to business school. You went to dental school. Maybe if we put our heads together. And he's like, he keeps pushing back. And I finally looked at him because my whole thing, which you didn't get to hear yet, is how do you break a pattern?
Yeah.
How do you break a pattern of thought? So I looked at him. I said, with all due respect, sir, I believe you have 1 year of experience. You repeated 29 times. Man, his face turned bright red. His ears started turning red. I thought the guy was either going to come over the table or have a heart attack on me because he looked pissed. But then he finally sat back and calmed down and went, maybe you're right. And it was interesting to see how that worked out, because I think you're describing that perfectly. There's a lot of people who literally have 1 year of experience. They repeat for a career as opposed to always learning, always improving the skill. And it sounds to me like improving the skill has been a game changer for you.
Oh, if you can't get excited about learning something new, then why keep practicing? It's time to quit. But I've never been more excited about practicing now. And I've never learned more, over a short period of time than what I've learned in the last year, 2 years, 3 years, 4 years. It's crazy, the technology we've got. Like the laser story. I go to my Seattle Study Club one night, and it was the night we were doing many talks from local docs in the club, and so I did a talk on Peri-Implantitis. And I've done a lot of implants, over the last, I was fortunate to be able to operate with P.I. Brandemark back in the 80s with some giants of dentistry. Carl Misch, Ole Jensen were there that week with me. Good people, and so implants have been good to me, and yes, I quit growing, but since then, my implant practice has just skyrocketed. It doubled, 1 year and then doubled again. And it's been crazy. And so the treatment coordinator is part of it. The minimally invasive surgery is part of it. Simplifying the process, streamlining it, making it happen faster, fewer steps, less bone grafting requirements, doing it that way, and has helped so much. But the other is this laser thing. I was seeing more and more peri-implantitis because I was looking more for it. I think there's a lot more than guys realize because they're not picking up probes and sticking them next to the implants because they're scared to or whatever. I know the hygienists aren't. Most of the dentists aren't. And I started looking for it, and there's a lot more there than meets the eye. And at first, I thought it was all because of cement. And there is a part of it with cement, but I believe most of it is an occlusal issue. And in particular, and people, and what I've seen is as dentists have started referring me more and more perio that I didn't really ask for or want, I'm seeing the same thing. In the face of good oral hygiene, and in spite of that, you've got bone loss on the posterior teeth. I'm just amazed how in every case almost, it's a lack of centric stops on the canines and a lack of proper guidance from the anterior teeth. And they're just pounding that bone on those posterior teeth. The bone is melting away, pathogens move in, and then it's a ball rolling down the hill. You take those cases and go put implants in them without addressing that issue, they're going to follow the same course of action. And so in trying to find some solution for peri-implantitis, nothing was working well, but I noticed that with the diode laser that I was playing around with, I saw some promising results. And as I walked out of the meeting that night, a dentist who I have high respect for walked up to me and said, "Gary, you're using a pop gun. You need to go check out the Millennium Laser, the Peri-Laser." And I said, what is that? I hadn't even heard of it. But I had respect for him. An oral surgeon is not too big to learn from a dentist. A surgical procedure or a technological procedure or a perio procedure. I love learning from people. What I've learned in life through my ranching interests is that I love the challenge of the fact that I can learn something from everybody. And I do.
Agreed.
There's somebody who can teach me something, everybody. And I don't take everything from anybody.
Of course.
Learn something from everybody. Don't take everything from anybody. That's been the rule for me, and it's worked. And so Pablo, he told me about this Peri-Laser. I investigated, and I read the papers on it. I was blown away. I'm going, my gosh, the scientific papers were awesome. And I'm going, why isn't this in every periodontist office and most oral surgeons' offices? So it's expensive, but I said, man, I took the plunge. I went and got trained. Came back, started treating implants with it first, was blown away. I've got now the largest series of successfully treated implants in the world, getting ready to publish a paper on it. But then, of course, one of the biggest risk factors for peri-implantitis is pre-existing periodontal disease in natural teeth. So I start treating these sick perio teeth adjacent to where I'm getting ready to put an implant, and what do you think happens? The bone starts growing back on the natural teeth, and then what do you think happens? The dentists are going, my gosh. This patient's telling me they had no pain, no swelling, and the bone grew back, and the pocket's gone, and the tissue didn't go down. The bone grew up. I mean, there's two fascinating, life-changing, medical, mind-boggling events of my career in life. The first happened when I began practice, and the second happened at the end. And that is at the beginning, when I was getting out of practice in '83, the word got out about Brennemark's implant and the fact that bone would bond to titanium. Are you kidding me? Bone doesn't bond to any foreign metal. The best we had at the time was stainless steel. You put a fracture back together with a stainless steel wire, take an x-ray in 4 months, it's got radiolucency around it. That was the best we had. You know, we had subperiosteal implants and Raymond's frame implants and blade implants, but they were being rejected the moment you put them in. All of them eventually failed. It was just how long was it going to take, you know? And now this guy's telling us that they osseointegrate. That was mind-boggling, and it changed my career and my practice. As I was stepping out into practice, that hit. And I got so interested in implants and have spent a lifetime putting implants in. But towards the end of my practice, I see that, yeah, they do bond, but some of them get sick too, and more of them than we realized. And as I search for ways to treat that, the literature says there is no solution that statistically, significantly was able to solve the peri-implantitis. And now I'm convinced that we've got data that's going to prove this Nd:YAG laser does it. It's unbelievable. And so that's mind-boggling. I mean, a standard surgical principle, you ask a medical doctor, if you implant a heart valve or a knee or a hip or a shoulder or any artificial thing into the human body and it gets infected, can you cure it with an antibiotic? Nope. You can wall off that infection, you can push it back.
Compartmentalize it.
But you can't get the antibiotics to kill the bugs on that surface. And so what's the surgical principle? You got to get it out. And so no different in the mouth. Those implants is just a matter of time before they fail once they start losing that bone. But now that we can stop it with the laser and that it selectively goes in there and destroys the pathogenic bacteria that are darkly pigmented, and it destroys the epithelial ingrowth that's darkly pigmented, leaves the connective tissue reedy pegs and reedy ridges, and then the stabilization of that clot at a second setting with a laser to serve as a guided tissue membrane and regenerate that bone. That's not supposed to happen, and yet it does.
You know, it's interesting. I've been saying for a long time when I talk about perio stuff, which is fascinating because I'm not a hygienist, I'm not a dentist, that you couldn't regrow bone. And what I just learned is I'm wrong. So I'm going to have to change how that is, at least if you have this technique.
I thought it's not possible, and yet it is. I can show you x-ray after x-ray after x-ray.
That's amazing.
It's unbelievable. I mean, and you know what? In this biostimulation mode and decontamination mode, I'm using it on bisphosphonate necrosis, bronze, bisphosphonate-related osteonecrosis of the jaws. People come in and they need a tooth out. It's hurting them, and you get a CTX and the blood level's too low for me to comfortably take it out. So we got to wait and buy time, but the patient's in pain. Either they don't want to do a root canal or they can't afford to do the root canal, and the tooth's going to eventually fail, so they want to invest money in it. But you take that laser and you go through that draining abscess, and you zap that abscess tract, and guess what happens? The pain goes away, the infection goes away, and I'm sure it'll eventually come back, but it buys you time to be able to get that blood level up so you can take that tooth out, and you don't have to charge a bunch of money because it doesn't cost much. But 5 minutes of decontamination, biostimulation here, and 5 minutes there, and a few $100s a fee per case, and all of a sudden, as an oral surgeon, I can pay for that laser without even doing perio.
Sure.
And what it does to hemangiomas is mind-boggling, and all of a sudden I've got all these hemangiomas being sent to me by medical doctors that have been on lips that no one wanted to touch. In a minute or two, it's gone, never to come back. And it doesn't hurt, and it's not surgery.
Awesome.
I mean, it's crazy. I mean, to me, it is the most essential tool in my practice, next to my exodontia tools.
That's incredible.
To not use it is for me to practice oral surgery without IV sedation. It is that frequently used in my practice.
I'll be darned.
Nuts. It's crazy. I mean, and I was the second oral surgeon trained there.
Huh.
And they had it perfected for 12 years. And I was the second one.
That's incredible.
That's nuts. And, so anyway, I get excited.
Obviously, I love it. You're just as excited as me. In fact, you're just as excited as me that I don't think anyone has ever come on the show, because usually they come on the show and say they can't get a word in edgewise with me. And you actually were able to flip that around, so I think that's pretty impressive. What concluding thoughts do you have as we wrap up? Because I don't want to consume any more of your evening, and it looks like we're about out of time. Any concluding thoughts, advice you want to give to anybody out there? Life advice, business advice, dental advice? I'll leave it open-ended.
Well, there's so much I could talk about. You Google my name, and you're going to find three things. You're going to find big bucks, big deer that I grew that brought the Jeff Foxworths and the ESPNs of the world to me. You're going to find big bass that I've grown that's now doing the same thing. But you're also going to find a federal indictment. I was indicted by the federal government on healthcare fraud, and I was innocent. But I had to go through a federal trial and stand trial before a jury, stacked with minorities,
haters,
lower income. well, so the government thought. But these people found me innocent, and it made me so proud of the jury system and the good people in this country that for the most case will try to do the right thing. I was impressed with the federal judge, but I was not impressed with the prosecutorial conduct. USA Today did an article on prosecutorial misconduct in this country and concluded after the Senator Stevens affair where he was put in jail and the prosecution hid evidence that would have exonerated him. And when I went through what I went through, I found out why. I mean, the government wins 99.8% of cases they prosecute against white-collar fraud cases. And I found out why. They are not honest with how they prosecute those cases. I'm just telling you, putting a pelt on the wall is more important to many prosecutors than finding justice. And it is scary and it's shocking, and we're beginning to turn the tide here in this state because of things that happened to me and to some orthodontists and other people. People are beginning to wake up about this problem, and there's some reform going on. And so what's my message? My message is we have an awesome profession. To be able to take care of people like we can and like we do and change their lives and help them is a godsend and an awesome opportunity. To get paid for it on top of that is unreal. I appreciate my profession so much more because I almost lost the ability to do what I'm so good at doing, and that's unbelievable. So embrace your profession. It's wonderful. Pour yourself into continuing education and love your patients and give back like we're doing right here at Dentists Who Care. I mean, we've given over $300,000 of free care away, and more than doubled what we did last year. So love the profession. It's wonderful.
As I started the show off with, you might be the most interesting man I've ever met in dentistry, and you kind of look like it, less the beard. And with that, I think I might go down and have me a Dos Equis with you.
Let's do it, dude.
And we'll call it a day. So I want to thank everyone for joining us this week. Can't wait to see you next week, 8 o'clock on the Mountain, 10 o'clock on the East Coast. Until then, have a wonderful day, and thank you, Dr. Schwarz, for joining me.
Thank you, my friend.
My pleasure. Thank you.